Hello, everyone. Today we're honored to have a conversation with Dr. Rafiullah Sadiq, a dedicated public health expert and a refugee health navigator at the Center for Immigrant and Refugee Health. With a background as a medical doctor in Afghanistan, extensive experience as a case manager in the United States, and a master's degree in international cooperation and humanitarian aid, Dr. Sadiq brings invaluable experience to this conversation. Join us as we explore the challenges faced by refugee families, how to identify these barriers, and explore effective strategies to overcome them. Over to you, Dr. Rafi.
Thank you very much, Jasmin Jan. My name is Rafiullah Sadiq, and I work with Center for Immigrant and Refugees Health as Refugee Health Navigator. As Jasmin mentioned, I'm here to present a very important topic, identifying and overcoming challenges faced by refugees' family. So by the end of this presentation, I hope those who are supporting refugees' family with their education and health have a better understanding about the important health and education barriers and the overcoming strategy to tackle those barriers. Next slide, please. We will start by understanding the main barrier and the practical strategy to overcome those barriers. In the next, we will talk how to identify those barriers. And at the end, we will talk about the vicious cycle of the barriers. Next slide, please. In the following slide, we will discuss the below listed important health, education, and integration barriers and the practical strategy to overcome those barriers. Next slide, please. Language barriers. Language is one of the most important barrier to accessing the health and education service and resources. Based on the a survey done by Immigration Policy Impact in 2022, 56% of Afghan in US age 5 and over reported limited English proficiency. This limitation can hinder refugees' understanding of health, education, and other essential information, including some safety rules and regulations. A student who cannot speak English may struggle to make friends in the classroom. So that can increase the risk of bullying and reduce student participation in the class, which then can result in lower academic performance. Recommended strategy to overcome this barrier or to tackle this barrier would be facilitating a flexible and part-time English classes for the refugee families or summer English courses for the students, employing multilingual staff in the school who can communicate between, who facilitate communication between teacher and these students and answer some of the questions that students may have about the school system and other problems they may face. And also translating the important guideline in education material will also help the newly arrival refugee understand those guidelines. Next slide, please. Lack of awareness and misinformation. A lack of awareness and misinformation is another important and most overlooked barrier to accessing the health and education resource and services. Many Afghan families are unaware of the available health and education resources and services. They do not know how to access there, what is the importance of those services, and how to navigate that. Misinformation. There is too many misinformation exists in refugees community about health and education resources and services. For example, one of the misinformation or myth exists among the refugee communities, like refugees are not allowed to enroll their student in their children in the school until they become U.S. permanent resident, or refugees are not allowed to access to the health services until they become U.S. permanent resident. In reality, this is not true. Refugees students are allowed to be enrolled in the school from the very first day of their arrival, regardless of their parent legal status. Recommended strategy to overcome lack of awareness and misinformation will be to raise awareness and address all those misinformation exists among the refugee community about health and education services. We can do this through developing and distribution of some information and education materials such as videos, flyer, brochure, and poster, which should contain culturally appropriate information in multiple languages. Next slide, please. Lack of legal document is another important barrier that most or some of the refugees may have that. It's important because without a legal document, they are not able to access essential services such as like housing services or some of the health services or driver's license and stuff like that. Also, those who have no legal document will not be able to secure formal employment and access to fair wages. And also, without legal document, the refugee may have to work for long hours in an unsafe condition with low wages. To overcome this barrier, the recommended strategy would be to partner with legal aid organization and provide free consultation about how to get legal documentation. And also, it's important to encourage the refugee to join immigrant group, which can sometimes offer very important resource and guidance about how to get the legal document and what to do for receiving those legal documents. Next slide, please. In this slide, we will talk about how culture affect or negatively affect the health and education of refugees. First, health. Afghan and rest of the Muslim refugee prefer to be treated by same gender. I will give an example. An Afghan woman with dermatological issue or gynecological issue may have significant concern about seeing by male doctor. That can affect their the care-seeking behavior, and sometimes it compromise their health and even life. To talk about how culture barrier affect education of the students in refugee. Refugees, family, and student themselves has different view on co-educational environment. That different view can influence children engagement with class discussion in education. To overcome this strategy and tackle this barrier, the recommended strategy would be to conduct culture competency training to help facility staff and school staff. It's important to inform school staff that girls, students may feel more comfortable if they are not required to sit close to the male students. And also, female patient will appreciate. It's important to inform actually the health facility staff that the female patient may appreciate if they are seen by a male doctor. Next slide, please. Employment demand. Most refugees face challenges in securing stable job, especially during the initial months and initial years. So, which lead them with low cost insurance and limited access to care, and that will in turn will increase stress and worsen health outcome. Also, those without well-paying job may not be able to afford proper housing, which then lead to destruction of their children's education. To recommend a strategy to tackle and target this barrier would be to supporting refugee with job training programs. It's important to train refugee how to develop their CV, how to navigate jobs, and how to prepare for the interviews. And also connecting those refugees with organizations who are specialized in career development will also help with those who are looking for the job. Next slide, please. Housing instability is another important challenge to which negatively affect refugees' education and health. Now, two of the examples about regarding housing instability will be overcrowding. Most of the refugee or some of the refugees, especially during the initial month, with 5 or more than 5 family members, have to live in one bedroom apartment. Lead them to have stress, poor health and education disruption for their children. And some of the refugees have severe concern about, like, if they are unable to pay the rent of house, they may be evicted and left without shelter. So that can severely impact refugees' mental health. Recommended strategy to overcome this barrier would be to be partnered with local housing authorities, landlord and non-for-profit organizations which focus on low-income houses. And also, it's important to raise awareness among refugees about available low-income housing. Next slide, please. Education barrier. Based on a survey done by Immigration Policy Impact in 2022, only 28% of Afghan immigrants have a bachelor's degree or higher. 29% have only a high school diploma. Rest of the parent refugees may not have the education skills to assist their children with their education or assignments. The refugees who have little or no education may not be able to secure high-paying job. Without high-paying job, they not be able to afford standard housing, and in turn, that can affect their health. Recommended strategy to overcome education barrier will be to facilitate parent with flexible and part-time or weekend education and training programs. Also, assessment-based placement of students and mentorship provision may also help those uneducated parents to have little stress about their children's education. Next slide, please. Most of the refugees have limited access to health care. Based on the delay module, there is 3 types of delays in accessing health care. The first one is delay in deciding to seek for the health care. The second one is delay in reaching to the health facility. And the third type of delay is delay in receiving health care in the health facility. In the right side, you see some of the challenges and obstacles cause those delays. The first, lack of awareness about health services or culture and linguistic barrier are the 2 or most important obstacles which cause the first delay, deciding to seek health care. Transportation barrier. Most of the refugees during the initial month, again, they do not have their transportation of their own, and also they do not know how to rent left and over, which can hinder their access to the health facilities. The last part of the obstacle, which is long wait time, high patient load, and insufficient staffing, or the obstacle which lead or cause the third type of delay, which delay in receiving health care in health facilities. Recommended strategy to overcome this barrier would be to increase awareness among the refugee community about the available healthcare services and the importance of healthcare services. And also, it is important to conduct culture competency training to help facilitate staff to provide culturally appropriate service to those refugees. And also, in order to make the healthcare easily accessible, it would be a good idea to think about having integrated health centers, health service centers, similar to the refugee health clinic. We have one in Sacramento, where we should have all the services together in one campus. And also, considering mobile health clinic in the refugees community will also ease the access or increase the access to the health facilities in healthcare. Next slide, please. Mental health is another challenge for the refugee. Some of the refugees suffer from chronic mental traumas which can affect physical health, education, and integration of the refugees. Stigma. Some of the refugees, because of the stigma, although they suffer from the chronic mental trauma, but they do not want to seek for the mental health services, which can compromise their health in EU and sometimes life. Lack of awareness in this regard is also important. Most of the refugees suffer from chronic mental trauma, but they are unaware of available mental health services. In order to tackle this barrier, the recommended strategy would be to raise awareness about the available mental health services and the importance of receiving those services. Also, to considering mental health screening for timely diagnosis. We can do this. We can do mental health screening in school while refugees come for their school children enrollment. And also we can have mental health screening in the health facility while refugees come for other diseases. Service integration, as I mentioned before, is another strategy for overcoming mental health challenges. Next slide, please. Time constraints. Some of the refugees, in order to cover their expenses, they have to work for long hours and take on multiple jobs, which leave them limited time for their own education or language improvement or to attend important medical appointment in social integration. So to overcome this obstacle and barrier, recommended strategy will be to support the refugee with flexible and part-time jobs and working hours, which will allow them have time for their education and language improvement. Also, facilitation of flexible educational program at evening and weekend time will also help those refugees to have time for their works. Next slide, please. In this slide, we'll talk about how we can identify all those barriers. One of the most important ways to identify those barriers would be to engage family and communities. So we can sit with community leader and family member and ask them about important and most overlooked barrier they are facing. The community engagement and family engagement will also help us in developing some of the strategy which is properly culturally appropriate and tailored to their specific needs. The second way of identifying the barrier will be to consider comprehensive assessment with using different tools such as survey, interview, focus group, discussion. We can find out best data about the burden of the existing barrier, and also later we can just use that data to advocate for developing strategy for overcoming all those barriers. It's important to remember that some of the barrier arise from the issue within our services or staff. So that's also important to evaluate our staff. I mean, the health facility in school to evaluate their staff in service for cultural relevance and competence. Also, as the way of interaction or the way we communicate with the staff in the client, it directly affect their service seeking behavior. That's also important to review how our staff communicate and interact with the clients. The next slide, please. With this slide, I would like to highlight two important points. The first one is that all those barriers we mentioned are integrated or interconnected. So in some of the barriers lead or cause the another barriers. For example, language barrier cause low education. So those who have low education may not be able to secure good or proper and well-paying jobs. So those who have no well-paying job may not be able to secure standard housing. So that is the first point. And the second point I would like to highlight is that when we are thinking of to develop strategy for overcoming these barriers, we need to think about holistic approach where we can target all or most of these barriers. Because sometimes when we target one of the barriers and ignore the causative or the leading barrier that may cause the actual barrier happen recurrently. Next slide, please. With that, I will stop. Thank you very much for your attention. And back over to you, Jasmin John.
Thank you so much, Dr. Rafi, for sharing these insights with us. I'd like to ask you a few questions just so we can dive a bit deeper into some of the topics that you mentioned in your presentation.
Sure.
So first, I'm wondering, what are some strategies that could be implemented to address language barriers among refugees, particularly in the context of education and healthcare access?
Thank you so much. That's a very important question. And I would just, there might be many strategies for overcoming them, but I would just mention a few of them here. The first one, as I talked before, would be to think about facilitating refugees family with flexible and part-time English classes, and the newly arrival student with summer courses actually about the languages. The second point that I want to highlight for addressing this, the language barrier will be to consider employing multilingual staff in the school and health facilities. Hiring multilingual staff from the refugee community will help or facilitate communication between students and teachers, and at health facility level, they will facilitate communication between doctors or health provider in their clients, which can bridge language gap in a faster and inclusive environment. And also at the school, pairing new students with mentors will help them adapt socially and academically, and will build very friendship environment to them. And also, and the last but not least, translation of the important health and education guideline in multiple languages will be some of the strategy for overcoming the language barriers. Thank you.
Thank you so much. And how do you think misinformation and a lack of awareness about available services can be addressed within the refugee community?
Thank you so much. As I mentioned in my presentation, misinformation and lack of information is one of the most important and overlooked barriers to accessing the health services and education services. And it's very important to be addressed. Some of the most strategy that I would like to suggest for overcoming this barrier would be, we need to think about raising awareness and addressing all those misinformation exists among the refugee community through developing and distribution of the IEC material or information and education material, such as brochure, poster, flyer, or videos, which would contain culturally appropriate information in multiple languages or in refugees' languages. That would be very first and important strategy for overcoming it. And also, we can consider community outreach, and we can just, through community outreach, we can communicate and collaborate with the Mullah imams and trusted leader. And through those two important groups, we can just reach the community member and we can sit and talk about the existing barriers and raise their awareness, and also we can just increase their awareness about the misinformation exists among their community. And also addressing myth will also be one of the important strategy to overcome those misinformation. We first need to collect information about existing misinformation and myth. After that, to think about developing and addressing those myth and misinformations. So these are something that I would like to suggest for overcoming the misinformation and lack of awareness. Thank you, and back over to you, Jasmin.
Thank you. Yes, I think you're speaking to how important it is to really have people from the community working with refugees. And I'm wondering if you can also speak a little bit more about the role that cultural competence training can play in improving the quality of healthcare and education for refugee families.
That's a very good question, Jasmin John. Culture competency training play a very important role in improving the quality of healthcare and quality of education. So it improve culture competency training, improve interaction, and reduce language and cultural misunderstanding between refugees and health and school staff by understanding each other communication norms. Also, cultural competency training empowers CBO staff, teacher, and health personnel to provide culturally appropriate service, education, and care. Cultural competency training also help with building trust among refugees community by fostering respect, empathy, and effective communication. In brief, cultural competency training enhance inclusivity and improve healthcare and education outcome for refugee family. Thank you.
Thank you. I have a couple more questions for you. How do you think housing instability affects refugees' mental health and children's education? And we know that housing instability is a huge problem across California, but what sort of partnerships do you think can be formed to mitigate these issues?
Thank you, Jasmin. As I mentioned during my presentation, many refugees have more than 5 children, and somehow even 9 or 10 family members. And those who have no job in the initial months, they have to live in 1-bedroom apartment or 2-bedroom apartment where they do not have adequate space for their children's sleep, for their children's education, or daily living or recreation. So this kind of situation increases stress, anxiety, and trauma within the family. And not just that, it disrupts the children's sleep and the family members' sleep and mental well-being and also academic performance of their children. And so this is very important. But the housing instability itself is a huge barrier, and one agency or one person can't just overcome those. We need to have governmental agencies, we need to have mental health provider, we need school and CBO all together to work on this issue. Housing agency and government can collaborate and provide stable housing and emergency support for the refugees. Mental health provider can offer counseling and mental health service tailored to the refugees' need. School and CBO can collaborate to facilitate flexible learning opportunity and access to essential housing resources. So all together, we can just tackle the housing instability itself and the rest of the challenges that arise from this barrier. Thank you. Back to you, Jasmin.
Thank you so much, Dr. Rafi, for your time and for sharing these valuable insights with us. I'm confident that this discussion will be helpful for those who are working to navigate many of the challenges that you mentioned with the refugee community. And I know that I always learn so much from you, and I think that this discussion is just a great reminder of the importance of cultural competency training, working with and consulting members of the community, and also building partnerships among service providers to implement some of the solutions that you mentioned. Again, thank you so much for your time and for sharing with us. I hope you have a wonderful day. Thank you.
Thank you so much, Jasmin. Thank you for having me. Have a great rest of the day.
You as well. Thanks.